Good morning, you guys. Welcome to Coffee with Christine. Here's my coffee. I'm so excited. You can see it's overflowing. Um, Today is our 19th episode. It's a lot of episodes that we've discussed now. And I guess we have, interesting. We have less than a month to go over for the voting. So today, I want to discuss a very hot topic, and I'm sure we can't finish it today. We're probably going to have to continue this tomorrow. It's a complicated one, just like with the homeless situation. But hey, let's do it. So today, for Coffee with Christine, we're going to be talking about illegal immigrants and like how I guess my position in how should be handled and just like the overall plan for them. And mind you, for this one, even though I migrated here from the Philippines when I was 18, I know that every situation is different, especially for people that have no papers. So I have been doing research, not just reading through policies, but also I have been talking to a lot of people in terms of their perspective, especially to the community that is affected by this whole discussion. So I guess just like everything else, it's a tough one because it seems like doing for me, it seems like doing the legal thing is not necessarily very kind to people. So we're kind of stuck in this loop. So let me start by saying there's estimated about 2.5 million illegal undocumented immigrants in California. So that's a lot. So I guess 39 million. So out of 39, now it's 39 and a half. So 42 million. That's a big chunk of population. We're not talking about like a few 100,000. 2.5 million is a lot. Is a lot. And so as I was talking to someone, they did share that it almost like California created a two-tier society. So, and I think it's such a good analysis. It's such a good analysis of what we're dealing with, and so we're gonna discuss that. I guess we're talking a lot. Hard to not have pain in the throat, but just say. Um, so because of all this, because I think California is trying to be kind and protect the undocumented migrants. Excuse me. What's happening is that we have created a two-tier system in our society. So you have the tier that is not just bound by the law, but has to follow the law. So that's that tier. And then there's a tier where everyone looks the other way. And I said this in some of my other videos too about some other stuff. Like, for example, kids being at Skid Row. Technically, that's not allowed. Any healthcare professional, it's their job to report that. That's required by the license, by the profession, and ethics. Because it's really not safe there. I think we can all agree with that. So the two-tiered system, the first system, you need to pay your taxes if you don't qualify for basic, if you don't qualify for social services and certain support, which we need to revisit that because it's stark of a difference. Something along the lines of, if you make less than 40K, you get access to almost about 60K, 60,000 in resources when it comes to food, when it comes to healthcare. And then once it jumps to like 60K in income, you have to pay a lot. So it's a we have to find the sweet spot. And then so logically, people would rather not work. They would rather not work hard. I remember one of our employees, we were trying to give her a raise, so she can make more money, and she refused, because she said that if we give her a raise, she's going to lose all these benefits. So it's just kind of, we need to look at that. We need to look at how the dispersion of resources, social resources, when it comes to income. Okay, so going back to the undocumented people. So you have your levels of people that are bound by laws and supposed to follow them. And then you have a second level. And these are the people that don't, we know that they're not here, they're not here legally. And so it's almost like in practice that the expectation for them is different. It really is. So for example, it's very hard to have a restaurant, for example. You need to be able to have license. They need to have, even those trucks, you need to have like access to washing hands, running water, restroom, things like that. Very, very strict guidelines. And they are there for a reason. I'm not saying that they shouldn't be there, although sometimes some of these regulations are like super strict and perhaps not super necessary. So anywho, those people are required to follow those rules. But especially in LA, you see how there's a lot of taco stands. And most of those, just for example, there's a lot of stands. And most of those have no permit. There's no permit from the health department, no permit, no business permit to conduct their business. We talk about sometimes kids are being haggled by cops for not having a permit for their lemonade stand. But that's that group of society that's required to follow the rules. And then on the other side of the society, they don't. And everyone just kind of look away. And it's not really fair for everyone, because for them, they don't get to access, like a safe place for their clients. And also, it's not safe for the community. So many times that you get, for example, I mean, this is kind of sad. I guess let me just say why one of my close relationship with permit, the place that we used to live at, we were renting a house, and we share a garage in the back of the behind the yard, and right next to that garage is a home. So that another house is being rented for someone else, and we share a garage. So I parked my car in that garage, so one space each. And also our washer and dryer were there. So anywho, these people sell tacos and stuff. And ever since then, like I cannot go to those places anymore, because what they do is that they order those big pork, those big meat, big boxes of meat, and they just leave it in the garage. And sometimes I would park my car and I just see, I don't think it's blood, right? It's like hemoglobin or something like that. I just see it like streaking on the floor. Like it's just very unsanitary. And they're just sitting there. The meat, I don't know how long it's out. And then that's what they serve. But what I'm trying to say is that the health department, that's their job, is to make sure that those products are safe. But it's not it's not handled that way. And in addition to that, healthcare, right? Healthcare is a big topic that everyone, it's in their agenda whenever you have a debate that the governors need to discuss. Like, what is the thought in healthcare? And I actually researched it because I thought that people without papers cannot purchase them, but I guess that's not true. They actually can. And the problem is it's so expensive. So if you don't have like a subsidy from your employer or the government, what happens is it's like $1,000 a month. $1,000, which is crazy. That's way too much. So they can't afford that. So what they do is that they use Medi-Cal instead, which, as I said in the past videos, most of that funding comes from federal, and it's seriously stated there that it's not for people that are like temporarily here. When Donald So they have no choice. I met this girl recently, and she's part of DACA, which I think is a good idea. There's a lot of people in there. Let me see. It's like 200,000. 147 active DACA recipients. So I think I'm not that familiar with DACA, but initial thought, I think it's a good program, because I do feel bad, as you guys know. I my passion is for the really old and the really young, and so I just kind of feel bad that they have to do that, to be in that situation. So anyways, this person that I met, she was telling me that she has to renew her DACA, and you pay, which is like, it's not too bad for the fee, but she didn't know. And this is common. Like, a lot of the people that are in that situation, they didn't know. And so she found out when she went to university, when she went to college, and they asked for her social security. And she found out that she didn't have one. So that was the interesting part. And so I asked her, I said, oh, you moved here when you were 2. How come your parents didn't fix it? Or, like, what happened? How come they didn't fix it or didn't tell you? And she said it's because, it's the saddest part. She said it's because they told her that they didn't think that she would go that high. They didn't think that she'll ever find out, or, will need to go to college. They just thought that she will work like an under the table job for her lifetime. And I think that's like really sad, especially for people that have kids. We always dream of our kids to have the best life that we can imagine. And so for people like them to just already, I guess, calculate and already assume that they are like not in the same level and can't dream that the same way, that kind of hurts me. That's kind of sad. But going back to healthcare, I understand why. I guess I understand the democratic thought. I understand the Democrats' perspective when it comes to insuring them, because we cannot just like let them. We cannot just let them be sick and or in harm's way. But again, as I mentioned before, that's already the case, in the sense that it's never going to happen that you're going to be not receiving care because of your status when it's an emergency, or if it's about contagious diseases. So the premise that they're going to go, they're going to go spread diseases, or they're going to, unfortunately go to harm's way in the side of the street, those are not gonna happen because we already have, thankfully, we already have laws to prevent that. Like I said, same thing with kids. Anyone under 19-year-old, we already have regulations and policies in place to make sure that those people, those group are taken care of. But now the Republicans' argument, and they have a point also, is that people like us, it's already like so expensive to for a lot of these things. Business permit is expensive, right? Um, Healthcare is expensive. I remember they were charging me, my employer, they were charging me over $500 a month to insure the family. That's crazy. And then so, I just found out that the kids are free. But I'm like, how come no one tells us that? So for us, it's not. So it almost feels like we pay more taxes, we pay more fees, and then government takes it and then give it to someone else. So I think that's the sentiment. And I just wish that from both sides we can listen to each other so we can finally find a solution for this. Because again, the Democrat, well, I mean, like it's not cool to give a fake data. So I hope that the Democratic gubernatorial candidates just doesn't know that it's already free healthcare to anyone who's young and in case of emergency and any public health concern. I hope they already know that, but that's not what they're saying to us. But I hope, but I understand the idea that everyone should have that healthcare. But we extended it to include like dental and vision and all these things. A lot of people that has papers, they don't even have that. So that's kind of like a challenging notion, especially for more people that are leaning over to the Republican side, because they really feel the squeeze. They feel the squeeze, and then it's almost like you watch them with your own eyes take your money that you work hard for and then walk over to the other side, to the other group, and hand it to them. So it's a little bit insulting, and it's pretty heavy because it's not even about you, but you look at your children and then you look at like the resources that's available to them. So I understand it from the Republican perspective also. That affects like a lot of things. I like the new law that we implemented federally, or I think federally, that employers need to provide insurance for anyone who has a full-time work. And when we think about it, it's not just because they want you healthy, but really it's because eventually you'll get sick. Everyone will eventually get sick. So that's another thing with this community. This is this second society, is that they really are being taken advantage of, because these businesses or these people that are employing them outside of not giving them basic wage, right? Like, so you're required to make minimum wage, and then you need to pay market price, right, for specialized work, painting the house, electrician, things like that. So those, they're not getting their fair amount. And then it irks me a little bit when we're so proud and we're saying, oh, that's cheap labor, but that's kind of not cool because you're taking advantage of those people. That you're saying, like, someone who has to go through licensing, not that I think that it's completely okay, we need to fix that also, but someone who needs to follow the rules, because of all the things they have to go through, they have to charge a little bit more. So let's say $30 an hour to paint your house, because they have to do safety. They have a lot of those rules. But someone you just pay under the table $20, it's kind of not cool for both of those community members. For the people that are not documented, because you're really taking advantage of them. Like, how about this? If you don't think you do, and you're doing those under the table stuff, you should pay them fair market price. So if you're hiring them because you care about them, right? That's the premise. And you're asking them to do something for you, pay them market value. If you're really just trying to help out, not yourself. Because, I said that in my speech that there's a lot of things that we do that we pretend is for them, but it's actually for us. But anyways, the employers need to pay. The employers need to pay the insurance, but they're not. And so that's kind of, someone has to pay that. And of course, who pays it? The government. But where does the government take their money? From us, from that other society that are bound by the law and bound by the taxes. The good thing is I have a plan. I don't know if it's gonna work, but I have a plan, and I've been thinking about it for so long. So those people too, and this is not just in. I want to clarify because I have friends actually that is within this circle. This is not only for undocumented. A lot of people do this for like even like under the table work, and it's just so sad because when it comes to like EDD and retirement, social security, they can't pull any money. And disability, they can't pull any money because it's been under the table the whole time. I actually think we should make that a little bit harder to do. We should make it a little bit harder to do, to manipulate the system and go and do a lot of those under the table stuff because, again, it's causing it so it's like an uneven expectation. It's so much easier. It's such an uneven way of dealing with the community. That's like, again, when you're looking at a regular business or regular workforce, you're like, okay, you're supposed to do all this, but then there's a certain group, not just the undocumented, that they're like, oh, okay, let's just do this under the table. Even hospice, right? The one that we're talking about, or the one that's been in the news lately. I was very curious because it's not just the healthcare people, it's also the people. There's some people, I don't know the percentage, but there's some people that agrees to that. So them as a patient, they're like, sure, I'll say that I'm sick or I need this, and in return you just give me a kickback. So that's also not cool because, again, they're thinking that they're getting some extra money, but in reality, it's coming out from the pool of money that belongs to everyone else. And I guess that's why when I say that I have that operations manager experience, like I had to deal with this because I see the consequence when you don't enforce the rule. You can always change it, right? There's a lot of, I heard this quote, something like, there's only two real law, the law of nature and then the law of the land, something like that. But everything else you can tweak. But I see the consequences when we don't follow those rules that we establish, because you're looking at it and you're like, hey, how come this is not working? We're still not making money, or we're making enough and not enough. So you tweak the program, not knowing that you have a giant hole that's like just draining all the money. And that's just not cool. And everyone, I guess, who participates in this type of like action from the society, they're really not helping. They're not helping, and it's just really moving that stress, the stressors for everyone else. So do I think that I guess I'll just close it with that because I don't want to sound like a politician that's just go and rant but doesn't give an actual answer. Do I think that people that are undocumented should get insurance just like people that are paying? The answer is no. because that money comes from somewhere, and that money will come from people that are already paying. So it is going to add to those people that is on that tier of society that I mentioned. I do want to add, I'm not saying to remove the required coverage, which is during emergency, for any public health issue, and for anyone who's a kid, anyone who's younger than 19. So those three that are already very strictly intertwined within our policies, I think those should remain for everyone. But for the most part, the other ones, I don't think that should be the case. I think what should happen is that we should give them a pathway to be able to afford insurance themselves and to really participate in the community, and remove them from that imaginary class that we have created for them. But we'll talk about that tomorrow, because it's a big topic. But that's I don't know. I guess I should have a straw. I don't know how to drink this while keep talking. But anywho, that's my position for that certain situation. Tomorrow we'll explore some more, just kind of what are the effects of this, because no one talks about it. No one talks about it. Every time they're like, oh, the insurance is so high, this is the car insurance so high, the health insurance so high, the premiums. Dude, there's a reason for that. There's a reason for all that. And stop saying it's because people are greedy. It's so much more than that. And every single person has a participation in making that so. And so we're going to discuss some more in terms of consequences for this alternative society that we have created for the sake of being nice. I guess that's not a fair statement. I shouldn't say that. I don't think it's necessarily for the sake of being nice, but this is the last thing I would say. Being a leader doesn't mean that you just do the things that is easy or kind. Being a leader is actually challenging. It's supposed to be hard. It's supposed to be not everyone can do it, because there's really hard decisions that you have to make. That's what being a leader is. Like, you have to make the tough call. And for people that has never been in that role, it's pretty eye-opening, because you have to calculate from different positions. Like, usually for most of the time, you calculate from like okay, this is me against you or with you, whatever the case may be, and you're looking at the now. But being a leader is about, while looking at this person, looking at the person behind them, and then looking at his kids, and looking at his parents, and looking at the person behind, and then looking at not just now, but yesterday, and tomorrow, and 6 months from now, and a year from now. So that's what a leader is. So it's one of those decisions that it doesn't always look right in the beginning. But in reality, when you're starting to zoom out and consider so many different factors, like, then it makes it like a lot more complicated, because as a good leader, your job is to actually to zoom out, like looking at a picture. Your job is to zoom out as far as you can while maintaining the picture. Then you have to still see this guy to make a decision about this moment, but zoom out as far as possible to consider everything else that is around. It's like D&D. You know how when the map is not as visible, but the dungeon master can see more. So yeah, of course, if you're just like looking in the map and you have like a very limited scope, that it's easy. It's easy to think that you know what this decision should be. But being a good leader is like being the DM, right? That you have access to a bigger map, and you know where the story leads. Not to say that you're right 100% of the time, but you have to take in all the considerations. That's the only way. So if you're judging an action of a leader from what you see like this without zooming out, that's you're not doing a good job. Same thing with the leader. If that's all that you see, that's not how it works. It's never, I've never seen it that's how it works. I guess I should say, when it comes to emergencies, for example, at least initially, you have to zoom in to take care of the issue at hand. But those are temporary, only in pretty important situation. But for the most part, you live in the zoom out moment most of the time. But again, the good thing is that I have a plan. And, I guess the plan would be nice if people can consider it regardless of who win. But we'll talk about that tomorrow. Since it's Friday, we can leave our week, and then maybe if you guys have thoughts or comments, then you can share it with me, and then we can talk from them. But anywho, I hope I didn't lose some friends after this video. But thank you for joining Coffee with Christine. We'll talk about it some more tomorrow on the same topic, and I will see you guys then. Bye.